So parotid gland lies below the external acoustic meatus and between the mandible, ramus of the mandible and sternocleidomastoid. So there will be zygomatic arch also. So this will become like this, the face and all. So this is a parotid gland. It lies here and it is covered by a capsule, and capsule is nothing but investing layer only, investing layer of deep cervical fascia. So when we trace the investing layer of deep cervical fascia, it splits and encloses the parotid gland as a superficial lamina and deep lamina, right? So you see here, this is the zygomatic arch, external acoustic meatus, and then mandible here. This is a parotid gland. So this investing layer, it splits into, encloses the parotid gland, no? So it has superficial fascia, it attaches to zygomatic arch, and posterior layer, it attaches to tympanic plate, styloid process, and angle of ramus of the mandible. Here between the styloid process and the angle of the mandible, this is the angle of the mandible, right? Here the thickening of the fascia is there, that is called stylomandibular ligament. Stylomandibular ligament. Now coming to the features, what it has an apex and 4 surfaces and 3 borders. 4 surfaces are base. Base is also called a superior surface. So this is how it looks like, base and apex. I can't show the other surface, but base and apex. Apex is directed downwards. Now base is also called a superior surface. This one, anteromedial, posteromedial, AM and PM means we have what is this? Antemeridian, postmeridian are there, no? Likewise you need to remember AM and PM. Anteromedial, posteromedial, superficial surface, and 3 borders are MAP, medial border, anterior border, posterior border. Right? So coming to the apex, so it is directed downwards, and the structure related are cervical branch of facial nerve, and also retromandibular divisions. You know already when we studied about the face. So this is a formation of the retromandibular vein, and it divides into 2 branches, no, anterior and posterior. So that will be happen at the apex. Now coming to the base, the superior surface, it has you see this diagram. This is the base, no? So external acoustic meatus. This is temporomandibular joint, and there are structures, superficial temporal vessels. This is a terminal branch of external carotid artery actually. Superficial temporal vessels means artery and vein, and auriculotemporal nerve. This is auricle, and this region is called as temporal, auriculotemporal nerve, branch of mandibular. So these are the structures present in the base. Now coming to the superficial surface. Superficial surface is just if you keep your skin like hand on your parotid gland, you'll have the layers are the skin, superficial fascia, deep fascia, and parotid lymph nodes. That's it. Some nerves are there, but remember this way easily. And coming to the surfaces, AM surface, anteromedial surface, posteromedial surface. For this I want you to remember this diagram. This diagram is like this. Some diagram is there even in the textbook also. So you see here, this is forms anterior border, posterior border. This is a medial border, M for medial. So this is anteromedial surface, this is posteromedial surface. Now anteromedial surface, I want you to remember ramus of the mandible. So ramus of the mandible has 2 attachments on either side, medial pterygoid muscle and masseter muscle, medial pterygoid and masseter. So this becomes the medial surface, anteromedial surface boundaries, ramus, masseter, medial pterygoid muscle. Now coming to the posteromedial surface, this is the posteromedial surface. I want you to remember these 2 processes, mastoid process and styloid process. Its attachments, that's it. Mastoid process has 2 attachments, sternocleidomastoid, posterior belly of digastric. Styloid process attachments are stylopharyngeus, styloglossus, stylohyoid, 3 muscles. 2 ligaments are stylomandibular ligament, stylohyoid ligament. So these 3, right? You can remember them. Between them, facial nerve will go, external carotid artery also will go. So these are the relations of posteromedial surface. Now coming to the anterior border, this is the anterior border now. This is a posterior, this is a posterior border and medial border. Anterior border has parotid duct here and facial nerve branches. Posterior border is related with sternocleidomastoid here, right? And medial border is related to the pharynx, that you need to remember this, right? If you remember this diagram, this is all easy only. Now structures present within the parotid gland. So they are VAN structures, VAN. What is the vein? Retromandibular vein is present in that. Formation you need to write. What is the artery here? External carotid artery. Its terminal branches are seen within this gland only. And nerves are facial nerve branches. You know that 5 branches are there, no? So you need to write that. And also parotid lymph nodes are seen. Now here parotid duct is also called as Stenson's duct. This duct is opens into the vestibule of the mouth opposite the crown of upper second molar tip. This is important. Parotid duct. There are some relations are there also. It can be asked as a separate question for this parotid duct. So read properly about separately. I am not mentioning those structures here. Nerve supply. This is a gland, no? So it is supplied by sympathetic and parasympathetic. So it's a flow chart you should remember. This is inferior salivatory nucleus. These are all preganglionic parasympathetic fibers. Start from inferior salivatory nucleus and passes through glossopharyngeal nerve, passes through tympanic branch, tympanic plexus, lesser petrosal nerve, and it enters into the otic ganglion. From here, the postganglionic fibers passes through auriculotemporal nerve and supplies the parotid gland. So that's about this. And then arterial supply is branches of this external carotid artery. Venous drainage also, which is into the retromandibular vein. And lymphatic drainage is they drain into upper deep cervical lymph nodes. So this is about the parotid gland.